On today's episode of Make It Make Sense Cardiology, we are going to talk about palpitations. What are palpitations? Palpitations is a very broad spectrum term commonly used to describe a feeling that patients will have of, I've heard it described as skipping heartbeats, racing heartbeats. One patient told me it feels like a flip-flop inside her chest. I even had one patient say it feels like inside her chest. Now, I don't know how to really document that, but that's what she told me. Nonetheless, cardiology will often be consulted or referred to investigate said feelings, because sometimes those feelings come with symptoms of dizziness, lightheadedness, just a feeling of general uneasiness, chest pain included, shortness of breath, all of it. Once cardiology enters the picture, of course, we have to get a very detailed history about, previous medical history, any surgical history, any recent illness, like the whole nine. We'll have a very extensive conversation about general overall health to see if there's any clues that lend to why the patient is feeling what they're feeling. In the hospital setting, the investigative workup is a little easier because we have immediate access to resources that you don't necessarily have in the outpatient setting, namely the heart monitor, the telemetry system. So in order for cardiology to effectively treat these palpitations, we first have to put a name to the rhythm that you're in when you feel what you feel. And again, in the hospital setting, chances are you've been wearing a heart monitor as a patient since you've been admitted into the hospital. And if you haven't been wearing a heart monitor, no worries. We can get one within a matter of minutes. Not a problem. Put the heart monitor on. Let's see what kind of rhythms the heart is in once you're feeling what you're feeling. When you do feel those symptoms in the hospital setting, you can always hit your nurse call button and let your nurse know, I'm feeling it, and then the nurse can go run over to the telemetry monitor, see what rhythm you're in, call cardiology, give us some updates. We have insight. Perfect. Now, while we are waiting in the inpatient setting, while we are awaiting for any sort of instance of palpitations to happen, we can then employ blood work, or at least look at lab work results. Why is that important? It's very important because there are certain metabolic processes and metabolic factors that can cause palpitations. Things like dehydration, electrolyte imbalance, severe anemia, all of those things can cause. They really can. Thyroid dysfunction is another culprit. An active infection, respiratory distress, sleep apnea. Oh my God, sleep apnea is a huge culprit for palpitations. And this is not to give you an exhaustive list, but just to kind of give you some food for thought. That their palpitations, what you're feeling, is not necessarily due to the heart malfunctioning or dysfunctioning, more so than it's something else going on in the body that now has begun to affect the heart. Same thing with the outpatient treatment or investigative workup for palpitations. Heart monitors can be issued in the outpatient setting also. Now, these monitors that you'll get from the cardiology office, these monitors will be in your possession and worn by you as patient for as little as 24 hours, as long as 30 days. First question that always comes from my patients, well, do I have to wear this monitor every minute of every day for the next 30 days? The answer is no, you don't. But just understand that the more you wear it, the more the monitor records, and the more the monitor records, the more information we have. So do with that as you will. Once you get the heart monitor back to the cardiology office, again, we download the recordings, and then we can see what heart rhythm you were in at the time that you felt what you felt. Because once we give your palpitations a name, that outlines the treatment program that we're going to employ. Now, I think it bears mentioning, or worthwhile mentioning, that treating the underlying culprit will get the palpitations to resolve. So all of those things that I just listed about anemia, electrolyte imbalance, infection, respiratory distress, all of those things, correct those and the palpitations will likely resolve. Now, if you have a patient who doesn't have any of those outlying problems, if you will, happening, yet when they return the monitor, or you look at the heart monitor in the hospital and you see abnormal heart rhythms, whether it's PACs, PVCs, and that's just skipping heartbeats generating from the top chambers of the heart and the bottom chambers of the heart respectively. You may even have a patient who has new onset atrial fibrillation or flutter or SVT or whatever it is, whatever the rhythm that is discovered. Bottom line is, we got to get a name to it. We got to get a name to it in order to treat you effectively. Now, there are some times where general cardiology may need to solicit the services of a rhythm specialist. There are certain cardiologists who are called electrophysiologists, and all they do is specialize in heart rhythms. Sometimes we, general cardiology, need to solicit the services of, our people to help treat some rhythms that are beyond our level of expertise. So don't be surprised, patients, if sometimes in the hospital setting, you may need to see more than one type of cardiologist to treat your palpitations. Your palpitations could very well be a rhythm that requires a pacemaker or a defibrillator. Don't know. Take home point: palpitations, broad spectrum term that means I feel something. Patients communicate that to their primary care doctor, their general medicine doctor, or in the hospital, the hospitalist. That provider will then get cardiology on board. Cardiology needs to put a name to what it is that you're feeling. Once we put a name to what it is that you're feeling, first thing to do is to treat the underlying triggers, underlying source, anything from anemia to infection, electrolyte disorder, sleep apnea. Treat the underlying contributors. Once those are taken care of and removed from the equation, if the palpitations or abnormal heart rhythm still exists, we may need to pass the baton over to the electrophysiologist, the rhythm specialist, but we will get to the bottom of everything and get your remedied ASAP and as safely as possible. That was a good lesson. Oh, that was a good lesson. Any questions, anything I can clarify, y'all know how to reach me. Like, follow, repost, share, all that jazz. I love cardiology and I feel myself getting giddy already. Have a wonderful, wonderful day. And nursing students, remember, you are doing well. You are embarking on a career that is going to impact you and so many people in your community positively. Impact your nursing family on the other side of this is here to support you in any way we can. Just reach out to us. We're like your big brothers, big sisters, big cousins. We're here for you. Have a great day.